Every hour somewhere in Tanzania, a woman dies giving birth, and 4 newborns fail to make it through their first day. What should be a day of celebration turns into a night of mourning, and too many Tanzanian families suffer the consequences.
So generally for Tanzania, we, in terms of maternal deaths, we haven't been making very good progress and for more than a decade. And this situation is even worse in the rural settings. We realize that, especially in the remote areas where many women cannot access facilities very close or nearby.
When you look at the challenges that we have in providing safe care in the country, we find that infrastructure is one of the challenges. You need the appropriate technology, you need the appropriate equipment that can fit into the situation that we have.
For most women in Tanzania, childbirth is routine, but for many, a complication during labour or delivery can become life-threatening. In these cases, women need access to emergency surgical care, including the human and physical resources to keep them safe during the procedure.
So one of the things which one has to consider as a professional when doing such surgeries for a pregnant mother is trying to reduce the risks or complications one can get during the procedure of cesarean section, but also after the procedure of cesarean section. And anesthesia is one of the critical aspects which you need to take control of.
Actually, the death right now is greater compared to the death from HIV, TB, and malaria combined. So you can see that it's a big impact.
That is why the Tanzanian government has made reducing maternal mortality one of its principal goals, starting with the upgrade of hundreds of health centres in or near rural communities. The government's investment includes the procurement of the universal anaesthesia machine, a world-class technology that can generate its own medical oxygen and deliver anaesthesia without electricity. So Gradian Health Systems, the non-profit company that supplies the UAM, has responded to the government's investment with one of its own. Tanzania's first anaesthesia and critical care simulation laboratory at the Muhimbili University of Health and Allied Sciences, one of 3 new simulation training centres being established at teaching hospitals in Tanzania.
Unapojifunza kwenye simulation na ukirudi kwenye reality, kuna vitu vinaoana, yani vinashabihiana.
I think what we're seeing is the government is very determined to scale up or strengthen the primary health care services. What it means, more theatres, more demand for skilled professionals, more demand for equipment, and better quality of service.
Tanzania is well on its way to making childbirth safer for the country's most vulnerable women and newborns, thanks in part to a strategic investment in anaesthesia technology and training.
Huduma imebadilika kwa kiasi kikubwa sana. Tumeweza kuokoa maisha ya kina mama wengi kwa sababu kwa mwezi tunaweza kufanya operation zaidi ya wakina mama 40 kwa mwezi. Lakini hapo zamani ilikuwa hatuwezi kufanya hivyo.
Kwa jina naitwa Madina Saidi, nimetokea Mtwara. Nashukuru nilifika jana usiku saa 5. Na bila kuchelewesha nikaambia mtoto alikuwa mkubwa. Nikaambia naenda kabisa kwenye operation na sijachukua hata muda mwingi. Nikapata matibabu na hivi sasa na mtoto wangu hapa. Nashukuru manesi hapa na madaktari walinihudumia vizuri bila matatizo yoyote.